Hello, we are from Group 2 from Clear 8. So we're going to present about the muscle contraction. And our group is formed by Hazrit, Kasina, Ainun and Aisha. So it is a very common thing to every people to experience with the muscle spasm. However, have you ever wondered the sign behind the muscle spasm? So in our slide, we're going to present about 4 contents of the muscle contraction. But the first one, we're going to focus with the basic of the muscle contraction. So definition of the muscle, it's actually composed of contractile tissue that is capable of changing its length by contracting and also relaxing. So how does it started about the muscle contraction? So the definition of the muscle contraction is an increase in the tension or decrease in the length of the muscle. It also formed that determination of muscle contraction is followed by muscle relaxation, which is a return of the muscle fibers to their low tension regenerating state. So we have the importance of the muscle contraction, which is help in maintaining posture, providing support, reduce movement, and also help us to maintain a constant body temperature. So we also have the bad side of the muscle contraction, which is by having over-exercising, because it can lead to the muscle burn. So recently 2 studies have shed light with this situation, which is by University of Utah and Loyola University Medical Center. So in order to avoid this kind of situation, we should try to play smart, which is consult with your body, how much exercise that you could perform, and also ask the expert, which means consult with the doctor to know which type of sports or exercise that you could be performed to avoid any bad situation or the muscle contraction. So I'm going to pass the next content to
Assalamualaikum. Now we will continue with the next subtopic, microscopic anatomy and physiology. So here we can see the human musculature, and it consists of major muscles in a human's body. So skeletal muscle in its related tissue account for about 40% of an average human weight, and muscle tissue has a density of 15% higher than fat tissue. Muscle tissue uses 3 times the amount of energy as adipose tissue. Fatty acids are the main source of energy in resting muscles, accounting 85% of total energy consumption. And also, tendons are bands of fibrous connective tissue that connect skeletal muscles to skeleton. Next, why muscles need to work in antagonist pairs? This is because muscles are only able to pull and not push. So how do antagonist muscles pair works? So one muscle flexes the joint and bends the limb, and the other muscle extends the joint and straightens the limbs. As you can see here in this picture, this is the antagonist muscles. So to lift the arms, bicep will contract while tricep will be relaxed. And when you put down your hand, bicep will be relaxed and tricep will be contract. Next is tetanic contraction. It usually occurs when skeletal muscles are actively used. So how? So a muscle is exposed to a rapid sequence of threshold stimuli, and the stimuli are strong enough to cause action potentials to occur, and muscles contraction will build up or add ups before tetany or maximum continuous contraction is reached. So what is tetany? Tetany is a condition caused by lack of calcium in the blood, which is hypocalcemia. Next is a muscle tone. It is a tension in muscle at rest. Fibers are contracting during the muscle tone. Muscle spindles and Golgi tendons organs are 2 types of sensory receptors that maintains the posture. So when tendons attach to an active muscles that stretch, the Golgi tendons organs are active, and the discharge of Golgi tendons organs increase as muscle tension increase. As a result, while spindles promote muscle activation, neural input from Golgi tendon organs prevents the muscle activation. Now we will continue with the next subtopic, which is the microscopic anatomy and physiology. As you can see here, this is the skeletal muscles fiber structure. This is a bundle of muscle fibers, and it has many myofibrils. And when we look through this, there are several parts and terms that are important here, which I highlight in the green one. So the sarcolemma or plasma membrane will form a transverse system. So the T-tubules penetrate or dip down into the cell and contracting, but not fusing with the sarcoplasmic reticulum, which consists of extended parts that function as calcium ion storage sites. It may contain tens of thousands myofibrils, which are the contraction operation of muscle fibers. Myofibril It is responsible for the skeletal muscle appearance of the straight muscles. So when we observe the relaxed sarcomeres, the thick filament which is made up of myosin and the thin filaments which is made up of actin are two types of protein filament. Because it only contains actin filaments attached to Z line, the I band is light in color. The A-band lux region contains overlapping actin and myosin filament, while the H zone contains only myosin filament. The sliding filament model describes the movement of actin filament in relation of myosin filament. As sarcomeres shorten here, the actin filaments slide past the myosin filament and approach each other and contract when relaxed. So we can see that the I bone shorten and the H zone completely disappear. This process repeat, grasping, pulling, and letting go. It is opposite when the sarcomeres are relaxed. This is the components of muscles contraction, and the actin filaments will only slide past myosin, and myosin will break down ATP to across the bridge that attach and pull the actin filaments toward the center of the sarcomere. Calcium ion is needed for myosin to bind with actin, and the ATP is to supply energy for muscles contraction. That's all from me. The next presenter will continue.
First thing first, we get the role of ATP in contraction. Muscle fiber rely on creatine phosphate, which is a storage form of high energy phosphate. But creatine phosphate cannot directly participate in a muscle contraction. So we need to change the creatine to ATP. And this is the fastest way of supplying ATP to the muscle. Next, ATP is for continuous muscle contraction. It is not to initiate a muscle move. So ATP is needed to remove myosin head from the binding site. Energy is stored in myosin head, and if there is not enough ATP, fermentation will happen without consuming oxygen, like we have learned in previous semester. This is the how ATP change to ADP, and we could get the energy to remove the myosin head. Okay. Next. Okay, next let's watch a video.
Notice how ADP and phosphate are attached to the myosin head. At the start of the process, the myosin heads attach to the exposed binding sites on the actin filaments to form cross bridges. Phosphate is released. Energy stored in the head of the myosin filament is used to move the head, causing the actin filament to slide past the myosin filament. The ADP is released from the myosin. The bond between actin and the myosin head is broken when an ATP molecule binds to the myosin head. The ATP is broken down to ADP and phosphate, releasing energy which is stored in the myosin head. The head of the myosin molecule returns to its upright position and is ready to bind to actin again.
Okay, next we are going to learn about the role of calcium ion in muscle contraction. The function is to remove tropomyosin from actin when muscle need to contract. And calcium ion is released from sarcoplasmic reticulum via impulses. And we all know that muscles do not work all the time except for cardiac muscles. Other muscles need a relaxation time, so they need a system to off the process. So we got here tropomyosin, which is a protein that will block the binding site on actin here. So myosin can bind to it and there's no contraction will happen. So when a muscle needs to contract, calcium will come and bind to troponin, the blue one, which are directly attached to the tropomyosin. And when calcium and troponin complex is formed, then they remove the tropomyosin from the binding site on the actin. So myosin can bind to the binding site on the actin, and this contraction will happen like usual. Okay, that's all from me. Thank you.
Hi guys, Assalamualaikum. So now I'm gonna share with you about what happened if muscle contraction does not function. So I have listed here several points that might happen if our muscle contraction does not function well. So for the first one, we have muscular dystrophy. Muscular dystrophy is a group of inherited disease that damage and weaken your muscles over time. This damage and weakness is due to the lack of protein called dystrophin, which is necessary for normal muscle function. The absence of this protein can cause problems with walking, swallowing, and also muscle coordination. For the second one, we have paralysis. Paralysis is the loss of muscle function in part of your body. It happens when something goes wrong with the way message pass between your brain and your muscle. Paralysis can be complete or partial. It can occur on one or both sides of your body. It can also occur in just one area, or it can be widespread. And then for the third one, we have cramping. Okay, for information, overuse of a muscle, dehydration, muscle strain, and simply holding a position for a prolonged period can cause a muscle cramp. In many cases, however, the cause isn't known. Although most muscle cramp are harmless, some may be related to an underlying medical condition such as inadequate blood supply. And then for the last one, we have tetanus. Tetanus, also called as lockjaw, which is a serious infection caused by Clostridium tetani. This bacterium produces a toxin that affects the brain and nervous system, leading to stiffness in the muscle. If Clostridium tetani spores are deposited in a wound, the neurotoxin interferes with a nerves that control muscle movement. So next, I want to share about a news that reported about a boy who gets myokemia after exposure to Kim Kim River pollutant. So this news might not be popular right now, but it was on 2019 during the Kim Kim River pollutant issue. So this is Irfan. He was confirmed to be suffered from myokemia, a type of alignment which caused several parts of his body to tremble. So for your information, patients with myokemia may present with some symptoms like pain, cramps, spasm, or weakness. So Irfan had developed some symptoms, for example, Parkinson's-like problems. So his legs started to shake when he was asleep. His heart was beating fast. So they decide to go to the hospital to get treatments, and then specialists carried out a lot of procedures including magnetic resonance imaging (MRI) to determine why his leg shocked. So after some examinations, specialists found that he was positive for myokemia after sniffing poisonous gas from the polluted Kim Kim River, which caused his lung to fail to be function well. So this was because the gas could be absorbed into a human body through the respiration channel and also the skin. So I think that's all. Thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good evening, everybody. So today we are going to have an interview session regarding to the topic muscle contraction. Before that, let me introduce our guest today, Madam Suzlawati binti Ahmad, staff nurse under the Ministry of Health Malaysia.
Okay. First, actually, yes, patient usually present with muscle contraction pain. The common problems are muscle spasm or muscle cramp. It is an involuntary contraction of a muscle. Okay. There can be micro injury or big tear to muscle during overexertion or overstretching during exercise. Okay, the muscle can be healed on its own. It depends on the degree of the injury. Okay. it's not only taking medicine or supplement could be the only one effective to reduce the muscle contraction. The physiotherapy also plays a big role in recovery for the muscle spasm or muscle pain, because the physiotherapy can ease the pain and spasm, or it also can decrease the tension in the muscle. For your information also, facial muscle are also a muscle and need to be exercised. The facial muscle loss is due to nerve damage. It may appear to droop or become weak.
Oh, I see. All right, to say thank you to you, okay, for answering our question during our interview session today. So
Okay.
I think that's all for our interview session today.